Good evening, everyone. Thank you for joining us for the webinar about strategies for choosing the right job. Tonight, we will hear from Dr. Taylor. In the meantime, I'm going to let a few people still get logged on before I let Dr. Taylor introduce herself. And I'm just going to take a moment to introduce myself really quickly. My name is Peyton, and I'm the Physician Engagement Coordinator here at Practice Match. And if you are attending, you might already know me because I work very closely with the Practice Match physician promoters and doing virtual career fairs. Hopefully, since you're here tonight, you know a little bit about Practice Match and what we offer physicians. Like I just mentioned, we do the virtual career fairs, we do webinars, we have free CV builder and a free CV review. We have scholarships, and we also have physician practice path career guidebooks and immigration assistance guidebooks. Please note that tonight microphones will be muted throughout the presentation. We will have time for a Q&A at the end, but if you do have questions as Dr. Taylor is presenting, please put them in the chat or the Q&A box and we can answer them as we go. So Dr. Taylor, if you're ready, go ahead and introduce yourself.
All right. Hi, everyone. Thank you for being here. I'm Dr. Taylor. I am a practicing doctor who also spends a lot of time talking about wellness topics that include choosing the right job and starting the right job. And so thank you all for being here. I realize that it's like 7 or 8 o'clock, depending on where you are. So I appreciate you spending your evening with me. And Peyton, if it's okay with you, I'll get started. Cool beans. All right. So first things first, disclosures. I'm a physician just like you. Just like I said, I have a passion for physician wellness through financial literacy. And so it's one of my passions to help doctors build wealth, choose the right job, and live life on their own terms. But I'm not a financial advisor. In parts of this talk, I'll be talking about money strategies and how to make sure that you get paid the way that you desire. I'll be talking about some tax tips and things like that. But I want you to know I'm not a financial advisor. I did work in finance prior to medical school, but take everything that I'm saying as more education and entertainment, not strict financial advice. And the other thing to note is that, let me go back. I have a blog. So my blog is Career Money Moves. And so if you zone out or forget some of the things that I'm saying, feel free to go to that blog. You can refer to that and you can get more information that way. And I have 2 websites, careermoneymoves.com and draliciataylor.com. So again, if you want to get in touch with me, you can do so that way. The other thing is that I work at Attend for Doctors. It's a new financial company. We help doctors with student loans, disability insurance, and much more things. I'm also the co-host of the Money Meets Medicine podcast. And so if you're a podcast person and you want to learn a little bit more about money, feel free to check those things out. Those are all of my disclosures. In terms of tonight, though, my job or my goal is to help you start off your job with the best chance of success. I know that you're, you probably just went through the job fair, and so you may be looking for a new job, or you may be in this transition period, or you may already have a job in mind that you think you want to start. My job is to help you start that job with the best chance of success, and I'm going to do so in 4 different parts or in 4 different areas. Number 1, I'm going to help you get your finances in order, talk to you about some things to look out for, some details to clarify before you start. Number 2, we're going to help you ensure that protections are in place. We want to make sure that you're on good footing. Number 3, we're going to clarify expectations that your job may have, expectations that your staff may have. And number 4, I'm going to talk to you a little bit about building in wellness and increasing happiness at your job. All right. So first things first, get your money right. This is probably the part that I'm going to spend the most time on because I find that it's the part that I get the most questions on. And again, if you have a question, feel free to ask it. You can put it in the chat or you can put it in the Q&A. I'm happy to answer in real time. All right. So first things first, knowing your pay. So there's one thing to have an idea of how much you're getting paid. There's another thing to know how much money is actually hitting your bank account. So a lot of doctors are getting paid on salary, some on productivity, some a combination of both. But what you need to know once you've chosen a job is how much is hitting your bank account. In other words, when are you getting your first check? So there's one thing, you have a lot of factors to consider, a lot of things that may take money away from your check that you may not realize. But one of the first things is to know when you're actually getting paid. And I'll tell you a quick little story. I was talking to a physician and he was saying that how, one of the doctors was talking about when they first started job. I think he was in a surgical subspecialty at a private practice group. And the nurses, started talking to his boss and saying, what, we keep seeing that this doctor keeps stealing sandwiches from the nursing lounge. And, at first we thought it was funny, but we realized he's doing it a lot and he's stealing a lot of sandwiches. Can you talk to, your colleague? Why is he stealing all the sandwiches? And so the doctor in charge kind of talked to that doc and said, "Hey, what's going on? The nurses are noticing that you're stealing a bunch of the sandwiches in the nursing lounge." And he said, "Well, I haven't gotten paid in 3 months." And what the doctor at that practice realized for the first time was that the doctor that they hired was getting paid solely on productivity, and they gave out their productivity bonuses once a quarter. And so that doctor was going 3 straight months without getting paid. And so I'm mentioning this story so that you know that even though you may get guaranteed a high amount, or even though you may, expect a high paycheck, you need to make sure that you are crystal clear on when your first paycheck is going to hit your bank account. If you're like me and you finish fellowship or residency and you plan to take 1 or 2 or 3 months off before you start your job, that's okay, but just make sure that you have a way to cover your expenses during that time period. All right. You also want to know how often you're paid. Oftentimes in residency or fellowship, you're paid once a month. When you're in attending, that paycheck is usually every 2 weeks, but you need to clarify with your own practice so that you have an idea of how often you're paid. A lot of physicians, as I mentioned, are paid every 2 weeks, and that may seem great on the surface. You just need to be able to plan so that you don't have any cash flow problems, right? If you know that you're only getting half of your paycheck at the start of the month, and you know that your mortgage is due at the start of the month, or private tuition for your kids is due at the start of the month, then you need to make sure that you're planning appropriately. And so knowing how much you're getting paid, knowing the timing of that paycheck is also really important. And lastly, knowing the degree of variability. There are some doctors like myself in primary care who are given a guaranteed salary for the first couple of years, and that can be great. But there are a lot of other physicians that are also paid on productivity or RVU, or they're given certain bonuses that add a substantial amount to their paycheck. You need to make sure that you are crystal clear on how much your paycheck could vary from month to month or from paycheck to paycheck. Because it could be that the first paycheck at the beginning of the month is just your base salary and you don't get that extra productivity until that second paycheck. Well, if all of your bills are coming out in the beginning of the month, again, it may create some cash flow problems for you. So you need to make sure that you're crystal clear on how much your paycheck could vary. And so knowing your pay is one part of getting your finances in order. Another thing is factoring in bonuses. I talked a little bit about this during our webinar last week, but I want to hit on this again and give you a little bit more details. It's really common nowadays for doctors to have sign-on bonuses, and that can be fantastic, right? It gives you kind of extra money that can help you get through before you start your job. But you need to make sure that you understand how it is structured. And when it is paid. So for some people, I've seen it paid as a residency stipend. They start getting that money before they ever finish training. For some people, it's a sign-on bonus in a sense that they get the money as soon as they sign on the dotted line for that contract. And other people, such as my current job that I'm about to start, they said, "Hey, you know what? We've had a lot of doctors say they want to, start with us, and then, maybe they get offered another better offer with a different group and they decide not to join. And so we've decided to give our sign-on bonuses until a person actually starts working on their first day." I've heard of other academic institutions where the sign-on bonus is split 50-50. You get half the first year and half the second year. So you need to make sure that although you may have a sign-on bonus, that you make sure that you know when it's paid. You also need to make sure that you know when it's taxed and how it is taxed. So for a lot of sign-on bonuses now, it's tied to how long you stay at the organization. They may say, okay, we'll give you $20,000, but you only get to keep the money if you stay with us for 2 years. If you leave before that 2 years, then you've got to pay the money back. Well, what you need to know is that money all or nothing? Meaning, if you leave in 1 year and 11 months, are you responsible for paying the full $20,000 back? Or do you only have to pay a portion of that back? And if you are there and you're staying for the full 2 years, you still need to know how that money is taxed. Because believe me, you're going to have to pay taxes on that money. And you need to make sure that you know how much money you're paying in taxes. Because you may be expecting a certain amount of money to hit your bank account when really it's a lower amount because you've got to account for taxes for that sign-on bonus. Another thing that I'm constantly asked is, Leisha, how should I take that money? If I know they're going to give me $20,000, should I get it now? Should I get it next year? Should I get it each month? What do you think is the best structure for me? And I say, disclaimer, not a financial advisor. I'm also not an accountant, but my father's an accountant, so I know a little bit about taxes. And what I usually suggest is that they get the money when they're in the lowest tax bracket. That means that year that you're spending that first, 6 months as a resident or a fellow, and then that last few months of the year you're starting as an attending, that's usually the last year where you're going to be in that lowest tax bracket. And so if you've got a $20,000 sign-on bonus, for example, you want to get that $20,000 when you're only in that 20% tax bracket instead of when you're in the 35% tax bracket. And so if they ask you, or if they give you a choice on when you want that bonus money, you want it that year that you're transitioning. You want it that year where you're going to pay the least amount in taxes. All right. The other thing is productivity. Again, a lot of doctors are paid on productivity, and it may be that you get a guaranteed amount to start, and then they give you a productivity bonus on top of that. Well, what you need to ask is, when do you get that productivity bonus, right? Is it once a quarter, once a year, or once a month? How often are you getting it? And what I always tell people is to ask for an audit. And I know that sounds like a dirty word, but let me explain what I'm saying here. Oftentimes in primary care, and I think, in other specialties as well, you may be billing one thing, but that does not mean that that is what your billing company is submitting to insurances. Maybe you're billing something as a 99214, and on the back end, your coder is changing it to a 99213. And you may not realize that because they may not be emailing you every time that they're changing codes on the back end, but that's going to affect how much you get paid. So you need to request an audit, right? I did this when I was a resident. I talked to, the leadership at my residency, and I said, you know what, can you make sure that, when I'm billing these things, you all aren't changing it on the back end? Or how often, how common is it for you to change my billing? Am I overcoding, meaning I'm billing it higher than what it is? Or am I undercoding, meaning I'm billing it too low? You want to make sure you're requesting an audit because, again, you deserve to get paid. And might I remind you, it's illegal to underbill or overbill. So you want to make sure that you're hitting that sweet spot, okay? And the other things is other kinds of bonuses, so like a retention bonus or quality metrics. My partner is a doctor, and at his place, they get a yearly quality metrics bonus. And so if the practice as a whole meets their goals, then every doctor in the practice gets a bonus. But that bonus is only once a year. And so it behooves you, because he may not be the only person that's at a practice like that. You may be joining a practice like that. And so it helps you to know, all right, is there some other kind of bonus that may be coming my way? And if so, when am I set to receive that bonus? All right. Another thing is getting the match. So this is something that I want to make sure that everyone's aware of, because everybody may not be some sort of investment person like I am, or into money like I am. And so I want to make sure that we're all on the same page here. One thing that I want to make sure that doctors get is their match. So what is that? That's a 401k or 403 match. What I mean by that, that's free extra money from your employer, oftentimes that you get by putting money into your retirement account. And it's usually based on a percentage of your salary. And you may be asking yourself, okay, Alicia, I'm not planning to retire anytime soon. I'm trying to get a job. I'm not trying to retire from my job. Why you should care? Well, one, it's free money, right? Oftentimes, if you put in a certain amount, they're matching you and they're giving you extra money as well. So if you're not getting that match, you're leaving free money on the table. So one, it's extra free money that you may get. Number two, it's one of the main ways that a lot of doctors start investing and building wealth and building up their net worth. All right, which can help you retire sooner, which can increase your net worth, allow you to kind of have more control over your time, work part-time if you want. And then another big thing for physicians is it can lower your tax bill. Oftentimes when you're contributing to pre-tax retirement accounts, you get to deduct that amount from your taxes. And as I'm going to mention, I think in a couple of slides, I'm going to show you some of the tax implications of going from resident or fellow to attending. And you're going to see how much you're going to probably pay in taxes. And one of the things that I get asked all the time from doctors is, Leisha, I feel like I'm paying a lot in taxes. Is there anything that I can do to lower my tax bill? And one of the things that I tell them is, hey, make sure you're maxing out your pre-tax retirement accounts, because that is one of the main ways that a lot of doctors are able to lower their yearly taxes. So making sure that you're getting the match. In terms of the match, you need to make sure that you understand when it starts, right? If your employer is going to give you some free money, you want to make sure you know when that starts, right? I've seen at some jobs where as soon as you start working on your first day, you're eligible to get that match. At my job that I'm starting, I have to be there for 90 days. So I have to wait 3 months before I get the match. I've seen some jobs, that's a lot of academic centers, they make you work there for a year. You need to make sure that you understand what this match is and when it starts. Because what I've seen at a lot of academic institutions is that maybe they don't pay as much as private practice, but they may make up for it on the back end by giving you a higher retirement match. And so you need to make sure that you understand how that is structured. All right. And on the, I'm not going to get into the weeds on different retirement accounts and things like that, but I do want to give you just a little bit of information here. You need to clarify what kind of investments and retirement accounts that are available to you. If you work for a for-profit institution, then oftentimes you're going to have a 401k. If you work for a nonprofit institution or an academic center or the VA, then you might have a 403b open to you. Oftentimes, some of these places have deferred compensation plans. So that's another pre-tax account that you can put money to called a 457B or a deferred compensation plan. If you work for a state academic institution, like I used to be at the University of California in Los Angeles, they oftentimes have a 401a. Some older jobs may have a pension. So you need to understand which accounts are available to you. And then we talked a little bit earlier about the importance, right? It helps you build wealth, helps to decrease your taxes, helps you to start saving for retirement. But it also helps for you to know the structure. A lot of places, they will automatically say, you know what, unless you tell us otherwise, we're going to deduct 3 or 4% of your paycheck into these retirement accounts. Well, if you weren't expecting that, then maybe you thought you were getting paid a higher amount than what you were, right? At other places, you may need to change it. Maybe you want to max out pre-tax retirement accounts, and so you want to max that out. Maybe you want to contribute more than they have as the default option. So you need to make sure that you understand that. And then understanding the investment options. So I realize that, you may not have this huge investing background. You may not know a lot about investing, and that's okay. But I just want you to ask some basic questions, and that's the investment options. A lot of doctors know that they should contribute to a 401k or a 403b, but they don't necessarily always follow through on that next step, which is picking the investments, right? And so you want to make sure that you know what you're investing in. And so I'm going to give you a crash course real quick. So a stock is ownership of a public company. So think Netflix, Google, Tesla, things like that, right? A bond is whenever you're loaning money to the government or to a company, and they're paying you interest as a fee for letting them have your money in the first place. All right. A mutual fund is whenever you purchase a group of stocks or a group of bonds. An index mutual fund, which is an index fund that I have on this slide, is a mutual fund, so a group of stocks or a group of bonds that follows an index. Think the S&P 500 or the NASDAQ. One of the cool things about owning index funds is you don't have to pick and choose individual stocks to buy. An index fund usually has you buying them all. So one of the more common index funds is the Total U.S. Stock Market Index Fund. That has you invested in almost every stock in the United States. Another common index fund is the Total International Index Fund. So that has you invested in most of the main companies all around the world. You'll usually see something called a total bond fund, which will have you invested in most of the bonds in the United States. And so I want to let you know these things because oftentimes these are the default options at a lot of employers. So if you don't choose your investments, this is usually how your money is invested. And usually it's invested in something called a target date retirement fund, which is a combination of these 3 more common index funds that I have here on the slide. So if you work at an employer or you are a resident or you are a fellow and you contributed to your 403b at your job and you didn't pick your investments, this is usually how your money is being invested. It's not a bad option. I just want you to be crystal clear on how that money's invested because it's not always that every job has the same default option. And I just want you to understand, again, if this is your money, you want to make sure that you know how it's being used and how it's being invested. And then you want to make sure that you choose a contribution amount. Some people choose 5% of their salary or 10% of their salary. Realize that there is a yearly max. As of 2023, the max is $22,500. And so if you're a new doctor and you're planning to max that out, you need to figure out, okay, well, what percentage of my salary is $22,500 and contribute that percentage each month into your pre-tax retirement accounts. And so making sure that you know how that works. I find that oftentimes this is not well explained to physicians and they have a lot of questions. And so hopefully that's helpful. The next thing is making sure that you're accounting for taxes. So in case you did not know, your biggest expense as an attending for most attending doctors is taxes. All right. As residents, you didn't make as much, so you didn't have to pay as much in taxes. Well, this changes a lot when you become an attending. Different taxes that you have to pay. I find that oftentimes people focus on federal income taxes, right? I'm at the 24% tax bracket or I'm at the 30% tax bracket. But there's other kind of taxes that come out of your paycheck that I find oftentimes physicians did not realize. So there's federal income taxes, right? And then there's FICA taxes or what we call payroll taxes. income taxes. So if you live in Florida, maybe you don't have state taxes and you're at the 0% tax bracket. If you're like me and you used to live in California, it can get up to 13%. Now I moved to Georgia, now the state tax rate is around 5%. So I want to make sure that you're understanding the different taxes that you're going to see come out of your paycheck, because again, it's going to decrease the amount of money that you get. All right. And I'm going to give you an example on these next few slides. So the average pay, I think, as a starting resident, I think is around $65,000 a year. Let's just say you're considering an attending job where you're going to start off making around $250,000. Let's take a look and see how the taxes are going to differ from a resident to an attending. So if you're a resident, I'm going to use this as an example. Let's say you're a resident making around $65,000 a year as a salary. And let's assume, I live in the state of Georgia right now, just moved to Georgia, so I'm using that as my example. Let's assume that you're living in the state of Georgia and you're single, so you're not married. All right, yearly taxes as a resident are nearly $18,000. So your take-home pay after taxes is around $47,000. This is assuming that you didn't contribute to any pre-tax retirement accounts. That means each month you pay around $1,500 in taxes and you take home around $3,900. Okay, your tax rate as a resident, 27%. Right? You may think to yourself, man, I'm paying a lot in taxes. Well, wait, because when you become an attending, it gets worse. In this example, if you're an attending and you're making around $250,000 and you're a single person in the state of Georgia, yearly taxes are now $88,000. This means as an attending, you're going to pay more in taxes than you made in salary as a resident. So yeah, you're taking home a lot more, but you're also paying a substantial more in taxes. So monthly taxes, you're paying around $7,300 a month in taxes. Yes, you have a good take-home pay, but realize your tax rate in this example is around 35%. It's much higher than it was as a resident. And so I'm saying this to say that finding ways to lower your tax rate is going to be important, and maxing out pre-tax retirement accounts is one way to do that. All right. As I mentioned, considering pre-tax contributions is important. It's one way to build wealth and lower your taxes. There's different accounts that may be open to you. And I want to make sure that you understand the differences. So you have your standard retirement accounts like your 401k, 403b, but you also, a lot of physicians, depending on how much money you make in your institution, you may have access to a 457b. This is technically a way to defer compensation. So you say, you know what, instead of, giving me my full salary, I'm going to let you give me $20,000 or so less, or $10,000 less, and you're going to invest that money on my behalf. And then when I leave the institution, you're going to give me that money back. This is oftentimes a great account for physicians who are planning to retire early, because unlike standard retirement accounts, you don't have to wait until you're age 59 or 55 to access the money in a 457b. You can access that money as soon as you leave your employer. And so this is oftentimes a good option for a lot of doctors. Just make sure you know how the distributions are and look into some of the details. But this is oftentimes a good account. You have an HSA or healthcare FSA. These are not the same things. Oftentimes you have to choose one or the other. Health savings account is a type of investment account that's open to doctors who have a high deductible health plan. If you choose a regular health plan, then oftentimes you may have access to a healthcare FSA or a flexible spending account. That's a little card that you can defer money on, or you can put money on that you don't have to pay taxes on, that you can use to pay for like prescriptions and doctor's visits and co-pays and things like that. So oftentimes you're choosing one or the other, but both of those accounts give you some tax advantages. There's also dependent care FSA. This is for like if you're a parent and you're paying for daycare, or if you're not a parent, if you're a physician and you're dealing with aging parents that may be in a nursing home or an assisted living facility. If you have a dependent, so someone that you're paying for their care, you can oftentimes put some money in this account. And again, you're not taxed on the money that you put in this account. And so I'm just giving you some ideas of ways to kind of lower your taxes and also be able to pay for some things tax-free. Let me give you an example here. So if you were a physician and you max out your 403b at your job, and let's say you chose a HSA or healthcare savings account, and you were able to get your employer match, you could potentially save over $10,000 in taxes each year. All right. And so I want to make sure that you know that that's open to you. I also want to make sure that you understand other expenses that may be coming out of your paycheck. One is health insurance. So I don't know about you, but the whole time that I was a resident and I was a fellow, I never once paid for healthcare. It was free. I never had to pay for the premiums. I didn't have to pay for anything. It was a free perk that I got for being a resident physician. Well, now that I'm about to be an attending, or now that I'm an attending, right, I have to pay for health insurance, and I have to pay for it. A part of it comes out of each paycheck. It also came with me selecting what kind of health insurance I wanted, right? Did I want a high deductible health plan, that would give me access to an HSA, but, would have some other drawbacks? Or did I want a regular health insurance plan that would cost me more per month, but if I were to go to the emergency room or go to a doctor's visit, I'd pay less for those kinds of visits. And so you kind of have to weigh the pros and cons and figure out what makes more sense for your family. Another thing is dental and vision insurance. I had this as a resident and a fellow, and I also have this as an attending. These are usually cheap add-ons. These are not things that you have to get, but things that are usually so cheap that it makes sense to add them on. But you have to choose what's right for you. Another thing that could be coming out of your paycheck is parking. I don't know about you, but I didn't have to pay for parking when I was a resident. Now that I'm attending, I got to pay for parking, which I think is kind of crazy that I have to pay to park at the place where I'm working. But that's how it works at a lot of, institutions. And so make sure you know how much that is and how often you've got to pay that fee. Another thing to look into and to note is short-term disability. We hear a lot of as physicians about long-term disability, which I will talk about in just a few slides, I think. But I want to make sure you understand what short-term disability is. This is usually what a lot of jobs will use to cover pay during maternity leave. So if you don't have paid maternity leave at your institution, they may have something called short-term disability, which means a portion of that comes out of your paycheck. So, you may have $50 or $100 or a small percentage of your income comes out of your paycheck each month into short-term disability. And then if you go on maternity leave, because you're about to have a baby, then you are able to collect from short-term disability, and oftentimes they will pay a percentage of your paycheck. And so if you are disabled or unable to medically work for more than 2 weeks, then you're eligible for short-term disability. Not every job has this, but if your job does, it's something to look into. And then other deductions that may be coming out of your paycheck, okay? Just make sure you're aware of those things. Total net pay. So making sure that you're accounting for taxes, as we talked about, making sure that you're contributing to retirement accounts and getting that max if you want to lower taxes, making sure that you're aware of other deductions that may be coming out of your paycheck. In my example earlier, that person had a gross pay or gross salary of $250,000 annually, which equates to about $9,600 every 2 weeks. But their net pay, once they accounted for taxes and maxing out retirement account, was around $5,600 every 2 weeks. Right? So they got almost half of what they were given on paper because of taxes and retirement contributions. And so I just really want to make sure that you're aware that the amount that hits your bank account is not necessarily going to be the amount that's on your contract that you signed. All right. And I always tell doctors one way to do this is to make a spending plan. I hate the word budget. I think it's very restrictive. So I like to call it a spending plan. And this is how I do it. I tell every doctor, make sure you have a realistic idea of your net pay. Your pay that's going to hit your bank account once you pay for health insurance, once you account for taxes, once you max out retirement accounts. All right. And if you need a ballpark, I tell every doctor to probably assume that you're going to take home around 55 to 65% of your gross pay. All right. After you account for taxes and retirement account. And then you want to make sure that you account for large fixed expenses. So once you know how much money is hitting your bank account, you want to make sure that you're accounting for any large fixed expenses that you may have to pay for. So examples, your rent or your mortgage, what do you expect that to be? Student loan payment. Student loan payments are about to restart. And although, they may restart and you may have a low expected payment because you haven't had to recertify your income in several years, realize that once you recertify your income, yes, student loan payment may be $1,000 or $2,000 a month. So make sure that you're accounting for your student loan payment if you have student loans. If you have a car loan, if you have credit card debt, right? If you have kids and you're paying for daycare or you're family planning or you're going through IVF or you're freezing your eggs. So making sure that you're accounting for any large fixed expenses that may be coming your way. And then after you do that, you want to make sure that you dedicate an amount to wealth building and to achieving some of your financial goals. Let me give you some examples. Excuse me, perhaps you're a young doctor and maybe you're single or you're engaged and you're planning for a wedding. Maybe you need to save it for a wedding. Maybe you are married or maybe you're single and you just want to buy a house. Maybe you want to save up a down payment for your house. And even if you're thinking about using a doctor's loan, which wouldn't require necessarily a down payment, you still need to cover closing costs and escrow, which can be between $10,000 and $20,000 depending on the amount of your mortgage. Maybe you need to build up your emergency fund. And so you want to make sure that you're dedicating some amount to short-term savings and cash. And then you want to make sure that you're having some money for vacation planning, right? You're in attending. You deserve to go on vacation. You need to relax, refresh, and recharge. And so you want to make sure that you're setting aside money to have the kind of vacations that you desire. Okay. Um, and then wealth accumulation, right? Making sure that you're contributing to your Roth IRA or your backdoor Roth IRA, making sure that you're paying down any debt that you have and doing any additional investing on the side so that you can build up your net worth and achieve financial independence. And so making sure that you're dedicating an amount to wealth building is important. College savings, 529 accounts if you have any kids. And then, lastly, you want to make sure that you're spending the rest, right? You worked hard to earn the money and you deserve to spend it how you choose. I just want to make sure that you make a spending plan, right? You're accounting for your large fixed expenses. You know what your net pay is. You're dedicating some amount to wealth building and achieving your goals. And then you're able to spend and enjoy the rest. All right. All right, that was step one. I know that was really long. The other ones are going to fly by. I promise you they're not as long. Step two is protecting yourself. So step one was all about getting your money right. Step two is about protecting yourself. And these are making sure that these three main protections that you have. Number one, malpractice insurance. Make sure you have it. It's mandatory. Protects you in case you get sued. I put this slide in here because there's two types, and I want to make sure that you know what kind you have when you start your job. Two main types. One is an occurrence policy. The other one's a claims-made policy. So an occurrence policy is very comprehensive. It covers you for anything that occurred while you worked at that organization. Even if you leave 2 years later, it's still going to cover you. So it's the most comprehensive, but it is also the most expensive. What a lot of places have is called a claims-made policy. This covers you for claims that are made while you work there, but it does not cover you if someone sues after you leave. So if you have a claims-made policy, you need to make sure that you're covering your tail, that they're adding tail insurance, and that they're paying for it. So malpractice insurance, that's one way to protect yourself. Number two is disability insurance, right? There's two types, short-term disability and long-term disability. I talked earlier about short-term disability. This is for short time frames like pregnancy. Long-term disability is for life or career-altering occurrences. So this is something that you need. All right. I realize if you're anything like me, you've probably gotten sent a lot of spam emails from lots of people trying to sell you disability insurance, and they're saying, buy it from me, and it seems like a scam. I get it, right? But this is something that you actually do need, right? A lot of your financial goals, a lot of the things that you're envisioning, a lot of the things that you want for your life and for your family are contingent on you being able to work and earn a high income as a doctor. So you need to be able to ensure your income. So that if something were to happen to you, you get diagnosed with a mental health disorder, you get in a bad car accident, you get diagnosed with arthritis and your hands don't work as well as they used to, or anything, that you are able to still bring in a high income. All right. So you need to make sure you have disability insurance coverage, long-term disability insurance coverage. It may be offered at your job, but it's usually less comprehensive and not enough. And you need to make sure that you have it so that if you leave your job, you're still protected. So I always tell people you need your own policy. I tell people to look into a GSI. That stands for a Guaranteed Standard Issue Policy. These are the kinds of policies that are oftentimes offered in residency institutions and fellowships. These kinds of policies allow you to get long-term disability insurance without medical underwriting. So in order for you to get disability insurance, normally you have to go through an insurance agent who, sends your information to an insurance company, and they can decide whether or not they want to offer you insurance. And oftentimes their decision is contingent on how likely they think you are to be disabled. So they ask you all kinds of invasive questions. How old are you? Have you ever been pregnant? Does anybody in your family have any, health disorder? And they're trying to figure. Unfortunately, were diagnosed with cancer during medical school or have a chronic illness. Maybe they have a tremor and they take propranolol. If you're on any prescription medications, they're going to ask about it. And they may deny you coverage because of that. And so oftentimes at residency programs and fellowship programs, they have a Guaranteed Standard Issue Policy. This allows you to get disability insurance without any medical underwriting. That allows you to get that policy without them asking those invasive medical questions. But oftentimes those policies are only eligible for people who are in residency or in fellowship or have graduated fellowship or residency within 6 months. So you need to look in to see if your institution has a Guaranteed Standard Issue Policy. And if not, you can get long-term disability insurance on your own. It's totally fine. I'm happy to help you if you need help getting that, but I want you to know that that's something that you do need. All right, tips for a good policy: make sure it's specialty specific, own occupation. Make sure you get riders or added protections for COLA, which is cost of living adjustment. You want to make sure that your payout increases with inflation. Partial disability, so if you're only able to work part-time, they're still paying you until you go back to full-time. You want to make sure that you have riders for student loans. You want to make sure that you have a future purchase option so that when your pay increases as an attending, that you're able to increase that payout. People oftentimes ask me, Alicia, how much of a monthly benefit do I need? I usually tell people that if you're buying disability insurance on your own, usually you're paying for it with post-tax dollars, so you only need to replace your post-tax income. In layman's terms, that means you only need to insure about 60% of your income for the most part. And so if you're someone who's looking for disability insurance and you need a way to protect yourself, you want to make sure that you get that. All right, life insurance, I won't get into the nitty gritty here. This is usually provides money to your family or your loved ones when you die. Who needs it? Those people who have someone who is dependent on their income. So, for me, I don't have life insurance. I don't have my own life insurance policy. Why? Because no one's dependent on my income, right? I don't pay for my parents, mortgage or anything like that. I don't pay for my brother's mortgage. So unfortunately, if I were to pass away, they'd be really sad, but they wouldn't undergo some sort of financial catastrophe because no one is dependent on my income. Now, when I get married, when I have children, then at that point, people are dependent on my income. So that's when you need life insurance. All right. Let me go back. There's two kinds of life insurances. One is term, one is whole. Term insurance is pretty cheap. It's sufficient. Most doctors will be fine with that. Whole life insurance is usually expensive, unnecessary, what most financial advisors will try to sell you. You can make the decision that's best for yourself and your family. I usually tell folks that you usually don't need life insurance for your whole life. You only need it for the term or the time period in which you're building wealth. If you're maxing out retirement accounts each year, you're going to end up with several $1 million by the time you finish practicing as a physician. And so you don't need life insurance for your whole life, because once you're retired, you have stacked up $1 million or $2 million, multi-millions in the bank from just maxing out your retirement accounts at work, that if you were to pass away, you can give your family members that money in your retirement accounts. And so you usually only need to cover yourself for that term or that time period in which you're still building wealth. And for most physicians, that's 20 or 30 years. And so I usually tell a lot of doctors term life insurance is sufficient, but you can make the decision that's best for you. All right, we're going to end with clarifying expectations and making sure that you're setting yourself up for wellness. So making sure that you're confirming the basics. So that means your schedule. What days are you working and how many patients per day are you seeing? Admin time, when do you have it? When is that? Is it changeable? Can you pick the day? RVU metrics, what's your threshold for a bonus at your job and how often do you get it? Location, commute time, right? Make sure you know when you're leaving your house. If you have multiple offices in different locations, making sure you know where you're going on your first day. And then hours, right? What's your typical work day? Are you oftentimes bringing work home? And then marketing to the community. This is very key for a lot of specialists, right? If you're a new doctor, how do patients know that you exist? Are they going to market you? Are they going to tell patients about you? When patients call to make an appointment, are they going to say, hey, there's this new doctor that's open? How are they going to tell people that you exist? All right, review billing. I talked about this earlier, but making sure that you're coding correctly, especially making sure you're adding modifiers on visits and physicals as needed. Requesting an audit. Again, I talked about that earlier. Making sure that what you put is actually what's being submitted. Make sure that you know how your billing compares to other physicians in your practice. Make sure you know where you stand. Understand when bonuses are paid, monthly, quarterly, annually. Another thing is to know the clinic workflow, right? What are the support staff that you're working with? How many medical assistants, how many nurses are at your place, and is that sufficient for you? Is the staff trained for this to run efficiently, right? Or are you at a place that there's a lot of turnover? Do you have all the supplies that you need? Maybe you're joining a practice and there are a lot of other subspecialists, and so they have everything that you need. But if you're going to be one of the only person doing certain procedures at your practice, you want to make sure that you have everything that you need to start off right. Supervision and teaching requirements. Are you going to have medical students with you? Are you going to have residents in clinic? Are you going to have to supervise mid-levels? Basically, are there going to be other people that might be interrupting your workflow and slowing you down potentially? Or are there other expectations that you have or that they have that you're not aware of? All right, and then standard policies. What's the late policy? What's the no-show policy? Making sure that you understand promotion criteria is really important, okay? Oftentimes, especially at academic institutions, research is required for you to get promoted. And it's not just any kind of research. Oftentimes, you have to publish in certain journals, certain impact journals. If you're not aware of what that is, you need to ask about it. Because it's not just, oh, you can get it published in any kind of magazine that you want. No, it needs to be high impact journals that are peer reviewed usually. And so you want to make sure you understand how that works, okay? Teaching. Do you get extra time for teaching? Are you promoted based on how much you teach? Typical timeline, right? Does everyone in your does everyone in your practice, is it 4 to 5 years before they get promoted, or do they get promoted in the first 2 to 3 years, right? What is your timeline for promotion? Productivity threshold, oftentimes that is a requirement to get promoted. So you want to make sure you know what that is. And then changes after promotion. For a lot of academic institutions, you start off as assistant professor and then you go to associate and then you go to professor, right? So what happens after promotion? Do you get paid more? Do you get a change in title? So understanding the promotion criteria and how that works, because oftentimes that is not well explained to physicians, and you need to make sure that you understand it so that you're not frustrated, okay? And then lastly, prioritizing wellness. I put this in here because I think it's really important. A lot of doctors are burned out, and so I think preventing burnout is really important, and these are some ways to do it. Number one, confirming the paid time off that you get, right? Vacation time. Is it 3 weeks, 4 weeks, 5 weeks, right? You may know the vacation time, but when does it renew? And does any roll over? I know at my job, right? I'm starting my job next month, right? And I'm thinking, okay, I get 5 weeks of vacation, so it should be from September to September. It stops at the end of the year, and then it restarts every January 1st, right? And so that's not something that I would have assumed had I not, or that's not something that I would have thought had I not asked. And so you need to make sure that you know when that vacation time renews and whether or not any roll over, because oftentimes there's a cap to how much vacation time rolls over. Holiday time, right? Which holidays do you get that may change from year to year? And is that included in your vacation time, or is that separate? Sick time. Oftentimes you may or may not get sick time. You may have to use vacation time. If you do get sick time, do you get all of that sick time at once, or is it accumulated over time? At my job that I'm starting, I start off with, I think it's 15 days of sick time. Actually, I get 15 days of sick time, but I don't get it all at once. I accumulate, I think it's like 1.5 sick days per month or something like that, right? Again, I wouldn't have known that had I not asked, because in residency, you get all your sick days, you get all your vacation days from the moment you start working, but that may not be the case at the institution that you were joining, okay? And do any days roll over? You need to ask that. Parental leave, right? How many paid days off do you get, if any? Do they do short-term disability? How does it work? Are you eligible for FMLA? So again, confirming paid time off is a big part of wellness, all right? Making sure that you're scheduling your vacation. I won't spend too much time on this, but you do need time to relax and recharge. You want to make sure you schedule in advance so you get the time you want. Oftentimes a lot of doctors with kids, they're all got kids in the school system, right? And a lot of the schools have spring break around the same time, winter break around the same time. So all the doctors are asking for the same weeks of vacation, right? And so you want to make sure that you put in your request in advance so that you're actually able to get the time off that you want. Making a list of things you'd love to do or places you want to travel and booking them in advance, okay? Using your out-of-office email so you're not checking your email or people aren't expecting a response while you're gone. Making sure that you're using your CME days, right? Are there any conferences or education that you want to learn or attend? You want to pick topics you want to learn, and what I find important is choosing places you want to visit, right? If your job is giving you $5,000 per year in continuing medical education money, right? And there's a conference in Hawaii, why not go to Hawaii? Right? Why are you choosing the conference in, I don't know, Chicago in the winter when you can go to Hawaii, right? So making sure that you choose places that you want to visit if you have the ability to do so. Asking about CME days, making sure they don't roll over, that you're using them each year. And using that money wisely, all right? Pinpointing when it renews and when it rolls over. At a lot of jobs, CME money does not roll over. So if you have $5,000 a year and you don't use that money, it just goes away. And so you want to make sure that you're using it, all right? Also, creating flexibility, creative scheduling. So if you want a particular day off, making sure that you're asking for that kind of stuff in advance, making sure that you're blocking off time for wellness, scheduling important family events. And as you start to build your net worth, as you start to build some seniority, making sure that you're kind of changing your schedule as you like. You might want to get rid of your night shifts, your weekend call, your holiday schedule. You may want to ask for higher compensation for the things you hate, and do a little bit more of the things that you like at your job. Establishing good relationships. One thing I've learned is that there's one thing that trumps talent and hard work. And you know what that is? Is being likable. It's being likable. If people like you, you are less likely to be sued. So it's protection for you as a physician. You're less likely to be fired. There's less attrition, meaning your staff is less likely to quit. You have more pleasant interactions. You have more job security, right? Your staff tends to work more efficiently for the doctors that they like, right? So there's all these perks of establishing good relationships. I want to make sure that you're aware of that. Obviously, I think most of us know this in the back of our mind, but we can forget it from time to time. There's some tips for patient interactions as well. If you're like me and you're in primary care, these might be helpful for you. I always find that I summarize the last interaction. So as soon as I walk into the room, or before I walk into the room, I look at my last note and I quickly glaze over my assessment and plan. And I usually start off with referring to that when I start my patient visit. It lets the patient know that I reviewed the chart. It tends to put them in a better mood overall. I try to remember one personal fact about my patients. I put it in the sticky notes. It helps patients to view you favorably. So if someone told me about their dog, or they droned on and on about, their husband that got a new job, the next time that I see them in the patient visit, I may say, oh, how's your husband liking that job? And I tend to find that it creates, a better interaction with my patients. And so that's something you may want to consider. Another thing is addressing the elephant in the room. So I tend to find that a lot of doctors run behind. I did, especially as a resident. So I usually open the door, and this is my opener. I say, I'm so sorry about the wait, but I appreciate your patience. How have you been since we last spoke? I immediately address the fact that I'm late, right? Because I find that if you don't address it, then patients are mad, or they give you some static, or they're not as happy to see you, and you spend a couple minutes trying to diffuse the situation. Versus if you just address it when you walk in, it tends to work out a lot better. You want to set clear boundaries and expectations, right? I let my patients know I'm not going back and forth on the portal, right? I'm not going to spend time away from my family answering 20 million portal messages in a row. So I have my staff trained. Hey, you know what? If someone asks and it's not something that the nurse can answer, then they need to book a visit. If it's not something that I can answer in a couple sentences, then they need to do televideo, right? So set some clear boundaries with patients. When patients are here in person, I find that oftentimes they come for their annual visit because it's free, and then they want to address 20 million issues, and they got a piece of paper of a bunch of sick issues or things that they want to address, right? And it's not realistic for me. And so I've trained my staff, hey, you know what? You ask patients, do you just want a physical, or you want to address issues? If you have issues, what's the two that you find most important? You want to make sure that you train your staff to triage this before you even enter the room, so that patients aren't mad at you when you let them know that. All right, summarize important info. Before I leave the room, I always summarize the main points and action items, right? I'm strategic about my closing, making sure that I put the onus on myself and invite them to ask questions so that I make sure that they understand what I'm talking about. So these are just some tips for patient interactions. You want to make sure that you're starting off on a good note. I always say hi and good morning to my staff. I know that sounds very trivial, but when I was a resident, actually, one of the MAs said she thought I didn't like her because I didn't tell her good morning. And I said, well, it's not that I don't want to tell you good morning. It's that I've got 20 million other things on my mind, and saying good morning to everybody is not necessarily my top priority. But I did learn something very valuable during that time. And that was a simple good morning can go a long way. Making sure that you're helpful, making sure that you're strategic about complaints. Oftentimes, it's very easy for us to notice inefficiencies. That doesn't mean that you should verbalize all of the ones that you see. So being strategic about that, being solution-oriented with problems. If you see an issue, making sure that you're coming to your staff or your leadership with a problem or a way to solve that instead of just mentioning the problem. I find that using positive reinforcement is more effective than negative reinforcement. That works for parenting. It also works for working with other people in a working relationship. So instead of always pointing out the things that you want your staff to do differently, whenever they do something that you like, you say, oh my goodness, I really love when you do that. Thank you so much. You just give them a lot more positive reinforcement. That tends to work better. Giving gifts and pleasantries can go a long way. Remembering their birthdays, giving them a little something for Christmas. When you get a bonus, giving them a little bonus, right? It makes them work harder for you. You want to acknowledge their hard work, give lots of credit and praise, because if you do those things, it's going to decrease attrition. Nothing bothers a lot of doctors more than having their staff turn over every 6 months. They got to train a new nurse, they got to train a new MA. And so you want to make sure that you're giving your staff all of the reasons to stay with you, and doing those little things can really go a long way. So key takeaways, I know I've talked for a long time tonight. Take home points. Number one, get your money right? Making sure that you know how much you're getting paid, the bonuses, when you're getting them, and you're accounting for taxes. Making sure that you're getting your retirement match, because not doing so is leaving free money on that table. It also allows you to start investing. Making a spending plan where you take your net pay, which is usually 55 to 65% of your gross salary, and you're subtracting out your big expenses that you know are coming. You're setting aside some money for vacations and short-term savings, and then you're spending the rest, okay? Number two, protecting yourself. We talked about malpractice insurance, long-term disability insurance, and life insurance if you need it, all right? Making sure that you're protecting yourself. Number three, clarifying expectations, knowing the basics, knowing the clinic workflow, understanding the promotion criteria, and understanding how your pay may change or not change over the next few years. And then lastly, confirming or prioritizing wellness. And that means confirming paid time off, establishing good relationships, making sure that you're likable at your job, and setting clear boundaries with your patients. All right. So thank you so much for your time. I know that that ran long. Here's some photos of me and my former co-fellow Nelson, whom I adore. This is me in Lake Tahoe. I was a ski doctor for Lake Tahoe for a month, so that was really cool. And this is a little photo of my niece and my nephew. My family is very multicultural. And so here are some of the little cuties that make my heart shine. So thank you so much for your attention. Sorry that I talked a little bit longer than I anticipated, but if you have any questions, I'm happy to address them now.
There is one question in the chat. She says, I want to contribute to a 401k, but after New York City rent, you see that, I only have $13,000 to spend on food, utilities, etc. each month. So is it still advisable to contribute the little money I have left over to a retirement account?
Hey, Jade, you know what? I want to say this. I applaud you, because it is not easy living in a high cost of living area and trying to do all of these things. You know, I used to live in Los Angeles. And so although it's not New York City, I understand where you're coming from. And that rent can be really expensive. Cost of living varies so much from place to place. And so oftentimes it may be more difficult for other people to save and invest than some other physicians who live in lower cost of living areas. So I commend you for even asking this question. In terms of whether or not it's still advisable to invest, I'm not sure what stage you are. I'm not sure if you're an attending or a resident. I'm guessing that you're a resident or someone in training. And if that is the case, I would say that every little bit helps. If you are able to even set aside just $100 a month, then that's better than nothing, because that $100 is going to grow and grow and grow over time. You know, I'll be honest, when I first started as a resident, I had a ton of credit card debt from medical school, paying for, you know, applications and interviews and flying all over the place. I had a ton of credit card debt. And so although I wanted to invest, I knew that it was probably better for me to pay off credit card debt. And so I said, you know what? I'm going to contribute 1% of my paycheck, you know, to my work 403b, or I'm going to set aside $100 a month for my Roth IRA. And then once I started paying down that credit card debt, I increased that month or that amount over time. So there's no shame in starting small. You got to start somewhere. All right. And so I'd encourage you to start investing. I'd encourage you to, you know, pick a target date retirement fund or pick some index funds to start investing in. Every little bit helps. You know, I don't want you to starve, but I do want you to try to prioritize investing, because I think it's going to go a long way if you're able to do so. All right. I think I see another question. Peyton, you mind if I read it out loud? Okay. What are some factors money-wise to look into when choosing where to practice geographically? I'm mostly looking at housing and tax, but what else can I factor in? So if you're thinking about your attending job, you know, taxes are a big thing, because that's going to be your biggest expense. Housing, for sure. You know, other factors to consider, or other things that you know, I'm trying to think money-wise. Certain places give you certain benefits. And so I mentioned the retirement match. As I was talking about earlier, I find that what some institutions can't do salary-wise, they may be able to do with their retirement match. So for example, I'll give you an example. I did my residency at Emory University in Atlanta, Georgia, and they, for the attendings that were there, they did not pay as high as other institutions in the Atlanta area, but they did have probably the highest retirement match that I had seen, which was nearly 10%. So if you were a physician making $300,000 a year, they put an extra $30,000 a year in your retirement account. And so I think another thing to look at money-wise when choosing a practice is to look at the retirement match. Obviously, you want to look at the cost of living where you are. Money just goes further in certain areas than in other areas. And so that's something to look into. Oftentimes I find though that the salaries and the pay can differ even amongst different places in the same city. So even if you choose, for example, a suburb or a rural area that's maybe 30 or 45 minutes outside of a major city, that could be a big difference in pay. And so that's something to think about money-wise. Another thing to think about is any bonuses that you may get. I talked about a sign-on bonus. There's also retention bonuses. There are cost of living adjustments. You want to see if your base pay increases with inflation. Last week when I was speaking, I talked about how you want to make sure that you understand how your compensation changes over time. And you want to ask how doctors who are hired after you, how their compensation may vary so that you're not paid less than the doctors who are coming in and being hired and paid after you. So those are some things to kind of consider in terms of money wise. But when I was choosing my job, I picked where my family was because that mattered most to me. And then I looked at, compensation, of course, but I also looked at lifestyle because to me, you know what? I knew that there was a certain threshold that I wanted to get paid, but I said, you know what? Thing that matters a little bit more to me than money? It's time with my family. And so if there's one job that maybe they paid $10,000 more, but I've got to take work home, then maybe that may not be worth it for me. So for me, it wasn't necessarily choosing the practice that gave me the highest salary. It's choosing the practice that had all of those other things as well. More vacation time, a higher retirement match, a better lifestyle, more admin time. And so these are some other things that may not be strictly money, but other factors to consider when you're choosing where to practice. So I hope that's helpful. How do I know if the salary being offered is competitive? How do I go about negotiating? So not only my salary, but benefits like vacation time and flexibility. Okay, so one of the things that you can do is look up, you're welcome. One of the things that you can do is look up what the average salary is. There is MGMA data. You oftentimes have to pay for it, but a lot of doctors have access to it at their job. So ask your program director at your residency or your fellowship for this information. There's also a Facebook group called Physician Community or Physician Side Gigs. You can join that. And they have a compensation database where a lot of doctors, and I think there's over like 70,000 doctors in that group. They have a database of a lot of physician salaries. So you can Google it, you can look at MGMA data, you can join those physician groups. They have access to some of the salaries, and they'll tell you average salary for your specialty, for your region of the country, along with 25th percentile, 50th percentile, 75th percentile, 90th percentile. And so those are some ways that you can go about knowing what to expect. And then you'll be able to know, if that is a competitive or not. All right. And then other benefits, once I have some jobs that I like, I start negotiating. I say, hey, I know you offer 3 weeks of vacation, but can we get 4? Hey, I know you offer 4 weeks. Can we get 5? So those are some things that I would say in terms of negotiating. I tried to talk fast because Peyton, I know we're running short on time. So hopefully that was helpful.
No, you're fine. Does anybody else have any other questions? I did see one and I answered it in the chat. This webinar, along with last Thursday, should be on the website by the end of this week. So I will get that link to you guys and send it. Once they are live too, I will send an email as well. But aside from that, is there any other questions that anybody has for Dr. Taylor?
All right. I think we're good, Peyton. All right. Hopefully I didn't bore y'all too much. Thank y'all so much for your attention.
Thank you all for attending tonight, and thank you, Dr. Taylor, for your time.
Thank you.
All right. Thanks, everyone. Have a good night.
You too.
Bye.